Hi, I'm Camille Strickland. I am a healthcare marketing and communications strategist. I'm located here in Chicago, Illinois. I've been doing this for about 17 plus years, helping health systems across the country of different sizes and types to differentiate themselves and position themselves for growth. So happy to be here today.
Great. My name is Kadesha Smith. I am the founder and CEO of CareContent. We are a digital strategy and content agency that serves hospitals and other organizations in the healthcare industry. And today we are here with Dr. Anthony Perry of Rush University Medical Center.
And hello, my name is Anthony Perry. I go by Tony. I'm a physician, and geriatric medicine is actually my area of practice. I've been working here at Rush University Medical Center actually for 29 years now, so since 1991, and have been working specifically in a role where I'm overseeing an entity we refer to as the Ambulatory Transformation Center. And we do things from delivery of buildings to digital programs. So we kind of say from bricks to clicks is kind of the scope that we do on a regular basis. So thank you for having me.
Thank you. So we're here today to talk about virtual care and how that has grown and sort of exploded at Rush. And I shared with you that I was very interested in speaking with you because I am a Rush patient. I was born at Rush. I have had 2 children at Rush, and I tested positive for COVID-19 at Rush. And a lot of the steps I took to get the test and understand what I needed to do to take care of myself occurred through virtual care visits with my primary care provider at Rush Oak Park Hospital. So I would love for you to just share with our audience how Rush has deployed virtual care in what seems to be a very seamless way. Maybe you know behind the scenes of a different story, but it seems to be very seamless on the consumer side. So I'm gonna let Camille dive in with the first few questions just to understand how you guys have successfully been able to do this.
Wonderful.
Yeah, absolutely. So I think one of the first things I noticed as, a resident of the market of Chicago was just how well you guys have marketed your virtual care program. And so throughout COVID, not being outside much, but definitely being online and looking at the ways that you guys have pivoted to really talk about how you're managing care virtually, or at least helping to assuage fears about COVID and things like that virtually has been really fascinating. And like Kadesha had mentioned earlier, just such a best practice. So prior to COVID, what were your growth plans around virtual care specifically for the facilities?
Yeah, I think, thank you for the question. One of the things that helped us be successful in sort of the COVID pivot was that we really had sort of an organized strategy that existed before COVID started. And we had been working on a suite of tools that we refer to as on-demand, with this concept that these were programs that are supposed to be able to be available to people sort of on demand, to meet them on their terms at a time of day that worked for them, at a place that worked for them, because they connected digitally with them. And it was primarily a combination of asynchronous visits and synchronous or video visits, right? And the asynchronous are more in the category of somebody enters information into a portal, the patient goes to a provider who then afterwards reviews the information and sends a response back. And we had a program set up where people could complete visits for low acuity medical problems, little back pain, urinary tract infections, coughs and colds and so forth through that asynchronous platform. And actually we're on target to do about 3,000 of those visits in this year, pre-COVID. And then in the fall, we had actually launched a video visit program as well, so that people would have access to on demand, sort of raising their hand and putting themselves in a queue and getting placed in a video visit with a provider. Again, for sort of lower acuity types of things that they might want to immediately connect with a provider. Much more of a transactional care kind of thing, not to replace the primary care provider like you referred to, Kadesha, in the system, but to really supplement the care that's available in the system to meet some of those simple, let's get you connected, let's get care to you right away on your terms, and let's let you go about your day kind of service. And that was a program that we had up and running and had done really close partnership with our marketing and communications folks on how we presented that to the public, how we communicated to them, how we integrated an app that our information technology team had built and had deployed over the past year and a half, which was sort of a wonderful foundational piece in everything that we had there.
Mm-hmm.